So we're going to look at this study from the Annals of Emergency Medicine that sought to evaluate the diagnostic accuracy of point-of-care ultrasound for hip effusion. This was a multi-institutional study done at 5 different institutions in the United States and Australia. And so the authors enrolled 161 pediatric patients for a total of 322 hip exams. The point-of-care ultrasound was compared to the radiology ultrasound of the hip, and the primary outcome was the accuracy of the point-of-care ultrasound in the hands of the pediatric ED physician as compared to the gold standard or the reference standard of the radiology hip ultrasound. And so the authors display their results here. They did split the results into what they called high-volume physicians for this hip ultrasound exam and low-volume physicians. There were 3 physicians that fell into the high-volume physicians that enrolled a little over half of the patient population, with the other 15 of 18 study physicians recruiting a little less than half of the study population. And so the test characteristics are great for those 3 high-volume physicians, and they're still very good for the low-volume physicians. But it does tell us that even though this is an easy exam, and I'm going to show you how to do the exam in just a minute, experience can help, and practice repetition can help in getting higher test characteristics. So to briefly discuss how to do this exam, one of the interesting points here is that the joint effusion actually accumulates on the femoral neck. That's the area being highlighted by the yellow circle on the hip x-ray as well as the yellow circle on the ultrasound image. And of course we know that black equals fluid on ultrasound, and so we're looking at there is indeed a joint effusion or a fluid collection in the joint space of the hip. The location we place the ultrasound probe to acquire this image of the femoral neck and the joint capsule is represented by the 2 images here. We will place the ultrasound probe just distal to the inguinal groin crease, and we will point the indicator dot towards the umbilicus to align the ultrasound beam with the long axis of the femoral neck. So now we'll get into some more interesting ultrasound examples. In this case, we've got normal hip on the left, abnormal hip on the right. The yellow arrow on the right is indicating the joint effusion at the femoral neck. The black arrow on the left is just indicating the iliopsoas musculature, which will overlie the joint capsule. And so here's another example of a pediatric hip effusion. This is on a more obese patient, so the actual hip joint is deep on the image. Then you can see the measurement where you apply the calipers. You're basically measuring from one side of the effusion on the femoral neck to the other, just underneath the iliopsoas muscle. And here you can see a side-by-side comparison. The image on the left is the non-affected hip with no joint effusion. The image on the right has a joint effusion present. And the accepted diagnostic criterion for whether or not there's an effusion present or absent is 5 millimeters in thickness of the effusion, or so greater than or equal to 5 millimeters of thickness, or greater than 2 millimeters of discrepancy between the contralateral hip and the affected hip. And here we've got another example of a positive hip effusion on a pediatric patient. And of course, sometimes in the workup of these patients, the next step is an arthrocentesis of the hip. And by knowing where to look, how to identify the effusion, it is not difficult, especially if you have good ultrasound-guided needling skills from other procedures or from other experiences, to get good at guiding the needle into the joint, as is being demonstrated here, with the needle being highlighted by the arrow. This is on an adult patient. So in this study from 2024, the authors looked at the cost-saving potential of point-of-care ultrasound for hip evaluation or hip effusion evaluation. They looked at it based on the number of cases of suspected septic hip joint that they had over a 5-year time period, and largely based on cost savings and the cost per bed hour estimates that they had, they came up with a number of $35,821 per year saved by using point-of-care ultrasound for these evaluations instead of radiology-based ultrasound. And this was a study we did at the University of Virginia, a single institution, looking at the difference in the amount of time between a radiology-performed ultrasound of the hip and a ED physician-performed ultrasound of the hip. And certainly no surprise, it's a much, much shorter time to diagnosis when the ED physician simply brings the machine over, looks at the hip sonographically, and decides yes, no effusion. And then we also looked at those patients who got arthrocentesis of the hip and found a similar result and a more dramatic result in that there was a much shorter time to arthrocentesis when the ED physician performed that procedure themselves. So to sum this one up, we've got an application of point-of-care ultrasound here where ED physicians have very high test characteristics and can accurately diagnose hip effusions on point-of-care ultrasound. So encourage you to consider using this in your own practice. Very easy exam to pick up and learn. And thank you to Journal Feed for hosting me for this video review.